Hello everyone and welcome back to Kaplan USMLE Step 1 Qblast. I am once again Dr. Jason Fernasiak, and we are here with this week's clinical vignette. As always, we're going to be going through a clinical vignette from beginning to end, discussing the right and wrong answers and the key points that's going to help you succeed both on the boards and on the wards. So without further ado, let's jump into this week's vignette. We have a 28-year-old woman who comes to the physician because of fever, mild headache, and sore throat. Her temperature is 39 degrees Celsius and her pulse 90 per minute. Physical examination shows generalized lymphadenopathy and a diffuse bronze-colored maculopapular rash covering the body, palms, and soles. The question here is which of the following laboratory studies is most appropriate for the next step? Is it A, biopsy with dark field, B, an ELISA test, C, antibodies to FTA, D, microhemagglutination, E, torch screen, or F, VDRL? So as you might have guessed, we are dealing with syphilis here, and the appropriate answer is F, VDRL. So let's review some of the key points of treponema pallidum. We're dealing here with secondary syphilis, and the findings on the clinical exam are going to be a maculopapular bronzing rash that covers the entire body. It's going to include the mucous membranes and the skin of the palms and soles. You may see condyloma lata, which are flat, wart-like growths on the perineal skin. You may not see that name on the boards just because the name gives away the diagnosis. So they may not use that. They may actually describe a flat, wart-like growth. So be thinking of that on the exam. In terms of testing, the initial test, because of ease and low expense, is a non-treponemal serologic study, such as the Venereal Disease Research Lab, or VDRL. Antibodies are produced which cross-react and agglutinate with mammalian cardiolipin, which is how the test is done. It arises in late primary syphilis, and they begin to fall in late secondary syphilis. If a negative result is obtained with a VDRL, you need to follow up with a specific treponemal serologic study, such as the fluorescent treponemal antibody absorption study, or the microhemagglutination tests. Now, I've included this chart here because I think it's a fantastic resource for both the boards and the wards. It includes the different phases of syphilis. Now, if you have some time, and I think you should pause the video here and really review this in detail. We also have a link to this information below. On the left-hand side, you'll see the stages of syphilis: primary, secondary, latent, tertiary, and congenital, and the various clinical presentations. Syphilis can present with a huge, wide variety of clinical presentations depending on the stage, which is why it's so tough to diagnose on the wards and why the boards love it, because they can ask lots of questions about it. And it's key to remember that different stages require different types of diagnostic workups. All of that information is included for you here. So what are our high-yield takeaways? We're dealing here with secondary syphilis, which causes bronze-colored maculopapular rashes which cover the body, palms, and soles. Remember looking out for condyloma lata, which are flat, wart-like lesions on the perineal mucosa. VDRL, the Venereal Disease Research Lab, is a non-treponemal serologic test that depends on the identification of antibodies that agglutinate to mammalian cardiolipin. With secondary syphilis, as here, VDRL is ordered initially and then confirmed with a treponemal-specific test. In primary syphilis, biopsy of the lesion and examination under dark field microscopy will show treponema pallidum. Tertiary syphilis requires specific treponemal serology, such as the FTA antibodies or microhemagglutination. VDRL may revert to negative in tertiary syphilis. Again, go back to that chart and review that. It's going to be important for taking care of patients and for gaining you extra points on the boards. Again, I'm Dr. Jason Fernasiak. It's been good to be with you this week. We'll be back next week with another vignette. Take care.